everyone, and welcome back to Bridging the Gap Chronic Illness, Mental Health, and the Human Experience. I'm your host, Karina Schrodell. I am a clinical social worker and doctoral student, and today we're tackling a question that I hear over and over again from individuals living with chronic illness. And that question is, what type of therapy should I be looking for? So, when you're dealing with chronic pain, chronic illness, or any long term health condition, finding support can really be overwhelming. We spend so much time searching for the right doctor, the right medication, finding the right specialist that we often overlook another very important piece to the puzzle, and that's our emotional and psychological support. So, today we're going to explore what the research says about therapy for chronic illness, which therapeutic approaches appear to be most helpful, and just some practical coping skills that you can begin using today. Most importantly, I want this episode to remind you of something I deeply believe. You are not failing because you are struggling. You are carrying something heavy, and learning how to carry it differently can change everything. So, before we begin talking about therapy, we need to acknowledge a truth that many people with chronic illness already know. Chronic illness affects more than just the body. According to research published by Centers for Disease Control and Prevention and numerous studies in health psychology, individuals with chronic illness experience significantly higher rates of anxiety, depression, grief, trauma symptoms, social isolation, and emotional distress. And why is this? Well, because chronic illness often creates repeated experiences of loss of energy, loss of predictability, loss of independence, loss of identity, sometimes even loss of relationships, careers, or dreams. And many people living with chronic illness are grieving a version of themselves that existed before that diagnosis. And grief is just not something that we can get over. It's something we learn to carry. So, is there one best therapy? And the short answer to that is no. There's not one perfect therapy for every person for every diagnosis. However, research consistently points towards several therapeutic approaches that are particularly effective for individuals with chronic illness. So let's talk about them. We'll start with cognitive behavioral therapy. According to decades of research, cognitive behavioral therapy remains one of the most studied and evidence-based treatments for chronic pain, anxiety, depression, and adjustment to chronic illness. Now, of course, CBT does not cure chronic illness. That's a common misconception. It's going to help you identify thought patterns that may increase suffering. For example, let's say you're having thought patterns like, I'll never have a good day again, my life is over, I'm a burden, I'm weak because I can't do what I used to do. Cognitive behavioral therapy teaches us to challenge these thoughts and replace them with a more balanced perspective. Not toxic positivity, not pretending everything is fine, but creating enough flexibility in our thinking that we can find some hope again. Another type of therapy is acceptance and commitment therapy, or ACT. And if I could recommend one modality that often resonates deeply with the chronic illness community, it would absolutely be acceptance and commitment therapy. ACT is based on a powerful idea, and that is that pain is unavoidable. Suffering can sometimes be reduced. According to research in behavioral medicine, ACT has shown effectiveness in helping individuals with chronic pain, autoimmune disease, cancer, and other chronic health conditions that health challenges that improve flexibility and quality of life. So ACT teaches us to stop fighting every difficult feeling and instead ask, what matters most to me? How can I continue living according to my values when symptoms are present? So ACT it doesn't ask us to deny our pain. It teaches us how to live alongside it. And for many people with chronic illness, this shift is life-changing. I highly recommend looking into a therapist who specializes in ACT therapy if you have chronic illness. We also have trauma-informed therapy. Many individuals with chronic illness have experienced medical trauma. Maybe they weren't believed, maybe they were dismissed, maybe you've spent years searching for answers. Maybe you've experienced frightening hospitalizations and procedures. So according to emerging research, repeated experiences of invalidation within healthcare settings can contribute to trauma responses. And this is why trauma-informed therapies can be incredibly valuable as well. We have approaches such as EMDR, somatic therapy, internal family systems, and one that I especially love is trauma-focused CBT. And these can help you process experiences that may still be impacting your nervous system today. Another great therapy is mindfulness-based therapy. I know mindfulness has become a buzzword, but the research behind it is actually quite strong. So according to the studies on mindfulness-based stress reduction, often called MBSR, mindfulness practices can help reduce stress, improve emotional regulation, decrease that anxiety, and just overall improve the quality of life. But as we know, mindfulness is not going to remove the symptoms, but it does change our relationship to the symptoms. So instead of constantly asking, when will this stop? We begin asking, what do I need in this moment? And that shift, it just creates a tremendous relief within you. We also have somatic and body-based therapies. This is an area that it's upcoming and it's kind of new, and I really believe it deserves a little bit more attention. So chronic illness is experienced through the bodies, yet traditional therapy often focuses exclusively on thoughts. So somatic approaches recognize that stress, fear, grief, and trauma are not only psychological experiences, but they're also physical experiences. If you're attending a somatic therapy session, you're going to try things like breath work, gentle movement, maybe some yoga therapy, some progressive muscle relaxation, nervous system regulation exercises, body awareness practices, and research increasingly supports these interventions for reducing stress and improving overall well-being. Our next question for today is, what should you look for in a therapist? So if you're searching for a therapist, here's a few qualities that you might find especially important. We want to look for someone, number one, who understands chronic illness, who uses a trauma-informed approach, recognizes the mind and body connection, someone who validates your experiences, someone who can focus on your strengths as well as your symptoms. We want somebody who supports both emotional and physical well-being. And most importantly, and I can't say this enough, we want somebody who makes us feel seen. The therapeutic relationship itself is one of the strongest predictors of positive outcomes. Now let's talk a little bit about just some practical coping strategies you can start with today on your own. These necessarily aren't going to cure your chronic illness. I don't have that power, but they can help you suffer less while living with it. Number one, practice self-compassion. Research by psychologist Kristen Neff suggests self-compassion is associated with lower levels of anxiety, depression, and emotional distress. Instead of asking yourself, why can't I do more? Try asking yourself, what would I say to someone I love in this situation? Then offer those same words to yourself. Number 2 would be pace yourself. One of the most important skills for chronic illness is pacing. Many people get trapped in a cycle of overdoing it on a good day and then crashing afterwards. So learn to honor your limits. It's not a weakness, it's wisdom. Create tiny wins for yourself. When symptoms are severe, large goals can feel impossible. So focus on achievable victories. Drink some water, take a shower, step outside, read a page of a book, and celebrate progress rather than perfection. I know we can be so hard on ourselves, but you're resilient. Celebrate those tiny wins. Try and regulate your nervous system. Just do some deep breathing. One of the simple breathing exercises I really love is just box breathing, which is where you breathe in for 4, hold for 4, breathe out for 4, hold for 4, and continue that breathing exercise. Try some grounding exercises, maybe some gentle stretching, some meditation, nature walks, yoga. I really love chair yoga, especially if you have a chronic illness that causes a lot of pain. Chair yoga is very simple and good for beginners. So these practices are going to signal safety to the nervous system and help reduce chronic stress activation. Next, we must stay connected. Isolation is going to worsen our suffering. Reach out to a trusted friend. Join a support group. Connect with others who understand. Healing happens in community. So as we end today's episode, I want to leave you with this thought. You don't have to earn rest. You don't have to prove your pain. And you don't have to wait until you're fully healed to live a meaningful life. According to the research, the therapies that seem to help the most are not the ones that promise to eliminate every symptom. They are the ones that help people reconnect with themselves, their values, their relationships, and their sense of hope. Living with chronic illness is not easy, but you are far more than your diagnosis. You are still a person with dreams, strengths, purpose, and value. Thank you for spending this time with me today. If this episode resonated with you, please feel free to share it with someone who may need it. I really believe that together we can continue bridging the gap between physical health, mental health, and the human experience. So, until next time, take care of yourselves, be gentle with yourselves, and remember that healing is not always about becoming who you were before. Sometimes healing is learning to embrace who you're becoming.